They think retirement is retirement. And so we're going to talk about that today. My name is Ed Weir. I'm a former manager of the Social Security Administration. I ran the third busiest office in the country, and I've taken a few 100,000 retirement claims. And I can guarantee you that retirement is not necessarily retirement. And let's talk about that. And so this is a live broadcast. If you're watching this recording, make sure you subscribe, come back, because at the end of this, the topic of the day should take about 10, 15 minutes tops to talk about. And then I'm going to open it up for questions. So I'll answer any of your questions on retirement, disability, survivor benefits, spouse benefits, Medicare, Medicaid for the remaining probably about 45 minutes or so. So if you don't have questions, make sure you subscribe. And that way, when you do, you, your family, friends, whoever have questions, you know where to find us. All right, let's go ahead and get started. And what do I mean that retirement is not retirement? Well, a lot of people put off collecting their Social Security benefits because Social Security, internally, we call it retirement. When do you want to file for retirement? And then quite often people say, I'm not going to retire. And so that's why they didn't file when they could have filed and started collecting that money. So they're losing out money. So when Social Security talks about retirement, they're just talking about when do you want to turn on your money? When do you want your benefit check to start coming? That's the only thing it means, because you can still technically work and collect Social Security benefits at the same time. I know for some of y'all out there, you're like, duh, yes, we knew that. But again, I've done this for a few decades, and there is a large percentage of people out there that are not getting their benefits because they think retirement is retirement. So if you're 62 years old, you can get retirement. You can turn on your Social Security benefits. But yes, there is an annual earnings limit. This year, it's $22,320. So if you're working, making under that amount, then you can start your Social Security benefits. If you are, this is another thing a lot of people miss, is the first year you can go from a yearly test to a monthly test. So there's a lot of people out there losing money because of this. They don't know this. The first year, so if you're, let's say, 62, 63 years old and you want to go ahead and start your benefits, but you heard there's a limit of $22,320 and I can't file for my benefits because I'm already over that for the year, doesn't matter. Social Security can switch you to a monthly test. So if you made $1 million from January until June, but you want to start your benefits in July, as long as you stay under the monthly limit, and this year it's $1,860, basically $22,320 divided by 12. So the first month you stay under $1,860 in earned income, not pensions coming in, or little slot machines, or unless you're a professional gambler and that's your job. But yeah, any type of pensions or inheritance or anything like that doesn't count. It's only work, earned income, W-2 wages, or net income from self-employment. So the first month you're under $1,860, you can start your benefits. So you can retire, even though you're like, oh, but I'm not retired, I'm still working. Yeah. Yes. You can start your benefits that month. So from January to June, you make $1 million, no problem. Starting July, as long as you're under $1,860 going forward, you can start your benefits, work, and collect Social Security benefits. Next year, you can't do the monthly. You can only do that essentially in the first year. As I said, with all my videos, everybody that watches me knows there's exceptions to the exceptions to the exceptions, but for the most part, that is the case. The next year, it's the annual earnings limit. So the following year, you have to stay under $22,320. And what if you say, I get the question, well, I'm going to be a little bit over. If you're going to be a little over, then Social Security holds back $1 for every $2 you go over. And what a lot of people do, they just let it ride. If they're going to be a few $1,000s over, they know next year when you do your taxes, you notify the IRS notifies Social Security, and Social Security said, hey, you made $2,000 too much. You owe us $1,000. So you have to essentially pay back $1,000. And so I've done a bunch of videos on overpayments and everything. So retirement is not retirement. And even when you do, work and get your retirement benefits, your benefits can continue to go up because Social Security determines your benefit amount by your high 35 years of earnings. So even when you start collecting your benefits, when you hit your full retirement age, you can make $1 million a month, and there's nothing withheld anymore in terms of the annual earnings limit, $1 for every $2 or $1 for every $3, or anything like that. Once you hit your full retirement age, make $1 million a month, doesn't matter anymore. But it will probably affect your benefit amount in a good way, because Social Security again decides how much you will make by your high 35 years of earnings. So if you're 70 years old, 80 years old, 90 years old, and you continue to work, then Social Security will look at your work from the previous year and look at your whole work history and say, hey, is this one of this person's high 35 years? Oh, it's not. Okay, then nothing. If it's one of the high 35 years, then they throw out one of the low ones, stick in the new high, recalculate, and your benefits go up. So retirement is not retirement. You can continue to work and continue to get your benefit increase. So you get two benefit increases. You get the COLA every year. And if you continue to work and get your high 35 years, a new 35 year, then your benefit will go up. All right. And here's one thing I want to, again, I've done this a few 100,000 times. And when I worked at Social Security Administration, and I would, just small talk with people. Oh, now that you're retired, you're 62, 65, you're finally retired after, 40, 50 years of work. What are you going to do? And, people, oh, I'm going to travel. I'm going to, I'm going to do this other thing, volunteer, spoil the grandkids or something like that. But from my personal experience, a lot of people that said, I'm not going to do anything. I worked for 50 years. I'm not going to do anything. Here's what I found. About a year after that, my 9 o'clock appointment walks in, and it's a surviving spouse claim. And I start going, oh, I'm sorry to hear about your loss. And wait a second, I recognize this name. Yeah, you took my husband's retirement claim last year. So please, get in, do something, because people that just say, I've worked for 40 years, I'm not going to do anything. And yeah, once they shut down like that, it doesn't work out very good a lot of the times. So please, if you're interested in giving your surviving spouse or divorced spouses surviving spouse benefits, then yeah. But if not, if you'd like to go around, for a few more decades and cause trouble, then please stay active. I mean, this is just from my personal experience doing this a few 100,000 times. All right, so that was a pretty quick one today, only about 8 minutes. So that's pretty good for me. All right, so let's go ahead and open it up to all your questions on anything. Make sure you type it into chat there. I've also got TikTok going here, and we'll get some questions in TikTok. Let's start off with TikTok here. All right, let's see. So any profit I make on a house sale is considered for Part B cost. Yeah, it's if it's a capital gains, I think the IRS allows a certain amount, and anything after that is considered capital gain. So this talks about a video I did, a short video. Well, I think I did. Yeah, I did two videos. I did a short video and a long video on this. But yeah, for Part B IRMA, it's the extra premium. Everybody pays $174.70 for Part B premium. And some people pay more than that, $100, $200, $300, $400, $500, depending on your earnings from 2 years ago. So if you were a high income wage earner 2 years ago, making over $103,000, then you're going to pay extra for your Part B premium. But for some reason, I have no idea why, Congress just didn't make an exception. Again, Social Security has an exception in 20,000 pages of policy. There's an exception to exception to exception. I have no idea why they didn't make an exception. If you sold your house 2 years ago and you made a nice capital gains, that you cleared, a couple of 100,000 in capital gains, then they consider you a high wage earner. And what's strange is that you can do a SSA 44. and it's basically saying you have a life-changing event. Yes, 2 years ago you were making $200,000 a year in income, but since then you stopped working. And Social Security, oh, okay, since you've had a life-changing event, we'll go ahead and we'll give you just a regular Part B premium. But for some reason, it's like, yeah, it was just a one-time sale of a house that you can't get an exception for that. So yeah, I have no idea why Congress didn't make that little carve out exception, but they didn't. And so yeah, but you'll only have to pay the Part B extra premium for 1 year, and then unless you sell another house the following year or something like that. So it's only for 1 year, if that's any consolation, which I'm sure it's not. So don't shoot the messenger. I turned 65 in July and have applied for Social Security and Medicare. When will I get my Medicare card? So you turned 65 in July. So if you've already applied, yeah, everything should come in the mail in 2 or 3 weeks or so. Social Security has to notify Medicare. Medicare has to print off your cards. And because you're 65, be careful. When you're 65, everybody wants to take you to the Medicare prom. And yeah, so I'm sure you're getting tons of junk mail and everything about setting up for a Medicare plan. And I've also got my own Medicare insurance broker team as well. So if you need help looking for a Medicare plan, a Medicare supplement, Medicare Advantage, prescription drug plan, vision, dental, all that kind of good stuff, just reach out to me, email me, call me, and I can find someone that works in your particular state to take care of you. 100% free service. All right. Do you have to pay for Medicare when you retire? Yes. If you paid 10 years into Social Security, you got your 40 years of coverage, 40 quarters of coverage, then Part A is free. And then Part B, the premium this year is $174.70. So, but Medicare doesn't cover everything. So there are 6 major gaps. The biggest one is the Part B co-insurance. So Part B only covers 80%. So if you have $100,000 surgery, you're going to have to pay $20,000 of that. So that's why almost everybody, unless you're independently wealthy, that's why everybody gets either a Medicare supplement plan or a Medicare Advantage plan. And if you watched all my videos, you know that I recommend Medicare supplement if it's in your budget. If it's not, then it's unfortunately not. But yes, either one of those. All right, let's go to some YouTube questions here. Can I claim benefits on ex-husband 9 years married? No, unfortunately. That is one exception that does not exist. It has to be 10 years, unless you were married to the person when they passed. But since the person is your ex, then I assume it was a divorce type situation. No, unfortunately, it has to be 10 years. But it doesn't have to be consecutive. One of the myths out there that people are talking about is it has to be 10 consecutive years. No, it doesn't really necessarily. Again, exception is exception. You can be married to a person for 5 years, get divorced, as long as you remarry before the end of the next calendar year and married another 5 years. Social Security can add those 2 points together. It has to be remarried to the same person. Can add 5 years here and 5 years here for a total of 10 years. So, and people are like, who does that? Stats I've seen is 6% of people remarry the same person they divorced. So, yeah. Don, my brother is planning to marry a lady from the Philippines. How long would they have to remain in the US for her to collect half of his Social Security? And does this time have to be continuous? Yeah, just no. If the person is married and yeah, it's an INS type thing. Is if they allow her in the country, green card or become a naturalized citizen, it's that's not an issue. No, that was if they're married, then she can get up to a half, depending on her age and all that kind of different stuff. But yeah, she's in the country legally. That doesn't necessarily have to be any time frame. Question, is it at the retirement age that I can go into the Social Security office and tell them not to send me Social Security so I can start collecting the 8% a year at the retirement birthday? Okay, so yes. So this is in reference to a little known hidden policy on voluntary delayed retirement credits. A lot of people don't know about this. And So basically, what you can do is when you hit your full retirement age, so about a month or 2 months before that, you can suspend your benefits at your full retirement age. Oops, this is live, I did say, right? So you can suspend your benefits at your full retirement age, and then get that 8% added to your record. So if suspended to 67 and then restart your benefits at 70, you've just added 20% of money to your Social Security check for the rest of your life. But yeah, so about a month or two, I'd probably do 2 months before, and make sure you watch the video. I'm sure that's how you found out about it. Hopefully, is you watch the video I did on that, and make sure you write down that Palms reference number, the RS000210. I think it was something like that, 320 or something. But write down that, because again, this is something most Social Security employees don't even know about, and it doesn't. Not a lot of people use it. So when you go in there, they will look at you strange and say, "Yeah, no, you don't know what you're talking about." And then you just hand them the Palms reference, and then the person will go away from the window for about 5 or 10 minutes and come back and go, "Huh, who would have thunk it?" So yeah, so make sure you have that ammunition ready, because they're going to tell you that you're crazy. Hello, Dr. Ware. Thank you for sharing knowledge. You're welcome. Thank you for the stream, Dr. Ware. Yeah, thank you. Thank you for 65,000 subscribers. Yeah, awesome, right? Yeah, and there's 70 million people on Social Security benefits. So I think we've Cadillac Jack. I think we've got a long ways to go, right? But I'm going to be here. This is my new mission in life, and my second or third life is making sure you all get every penny that is your money. Lawrence, Dr. Ware, for your constant commitment to provide valuable insights. You're welcome. And oh yeah, by the way, happy happy Memorial Day to everybody. I know it's Happy Memorial Day, but Memorial Day. Out there, enjoy the family. Thank a vet, all that kind of good stuff. I'm an old Marine Corps sergeant, but everybody always thanks me, so you don't have to thank me. I appreciate it. If I'm getting HSA on my job now, turning 65 this November, can I sign up for Part A without a penalty, working until 66? So yeah, so if you want to sign up for Part A, then you have to stop your HSA 6 months before, because it's not really a Social Security issue. So a lot of Social Security employees don't know about this, and they tell people the wrong information. And what happens is you essentially get jammed up with the IRS, because when you sign up for Part A, they essentially give you like a 6-month retro coverage, and you cannot pay into an HSA contribute. You can pull out your contributions, but you cannot contribute to a health savings account while you're on Part A. So the IRS will say, hey, the money that you saved during that 6 months, you're going to have to pay back, and there's an IRS issue. And so it's an IRS issue. But yeah, so 6 months before you're going to start your Part A, then stop that HSA, stop contributing. Jerry, I enrolled in Medicare Part A in 2023 at 65. I applied for Part B 5/24 to start August. Okay. When can I expect to hear from Social Security my enrollment in Part B? Yeah, it should be pretty quick. So you probably already have your Part A card, and then yeah, Medicare is going to send with your new card. It'll be the same Medicare number and everything like that. So yeah, you can probably go online to Medicare.gov and go in there and say, oh, Part B has already started. So it shouldn't take that long. If you applied May 1st, yeah, that's super easy. It's just a matter of the two computer systems, Social Security talking to Medicare and Medicare printing the card and all that kind of stuff. So yeah, it's probably good. And it's not going to start to August anyway. So, but now you have to start figuring out what you're going to do with the Medicare plan. So again, if you know a good agent or a broker, again, an agent, Medicare insurance agent, a kind of particularly a captive agent, works for one company. So if you call them and say, hey, what do you recommend? And guess what? Henry Ford, can have any color car you want as long as it's black. But a broker, and that's the only people I deal with is brokers, they work for you. They look at all the plans in your area and say, hey, based on this, and this, your health and your doctors and your prescriptions and all this other kind of stuff. Here's, one out of the 50, 60, 70 plans in your area. Here's one or two or three that I recommend. And so, yeah, you can give us a call, email me, and say, hey, my name is this. I'm from the state, because they're all state specific. Give us your phone number and say, hey, I want I'm going to start my Medicare in August. Hook me up with someone that can help me out. And again, no cost, zero cost to you for the help, and no no obligation. So if you don't like their recommendations, say, have a good day, goodbye. A high 35 year could be when a person is 80 years old. Thank you. Yeah, exactly. Yeah. Yep. Absolutely. As long as and you will pay FICA forever, death and taxes. Um, all right. Let's see. Medicare. Can you start Medicare A and Medigap for 1 year and stop because of reemployment? I have the opportunity to work freelance at age 65 for 1 year and then be reemployed or benefits. Yes, you can stop part B, but not A. But in order to get a Medigap plan, Medicare supplement plan, same thing. In order to get a Medicare supplement plan, you have to have Part A and Part B. So you can't stop A, but you can stop B. And A is free anyway, so why would you stop it? So yeah, Part B, you can stop that. And yeah, the Medicare, the Medigap plan, if you're going to be in a new enrollment, that's it depends on your state. I would find someone that's good in your particular state. Again, I've got a nationwide team, so if you want us to go over all your options and check out what's available in your state, because all insurance is state regulated. Medigap is a national program, Medicare is a national program, Social Security is a national program, but Medicare Advantage and prescription drug plans and Medigap, Medicare supplement plans are regulated by the states, and they all do their own strange things. So, yeah, interest about staying busy at retirement. Yes, yes, and I've always found the hybrid solution is always the best. So yeah, if for the first year, if your plan is okay for the first year, I'm not going to do anything. I'm just going to sit around and wear out my lazy boy for a year. But I have a plan. After 365 days, I'm going to do this. Then you've got something planned in sight. But if you're just going to do nothing and with nothing planned, and in the Marine Corps, particularly when we were stationed in overseas in Okinawa, the Rock, everybody's get a little 8.5, a little picture of a plane with that 365 days on it. So they would like mark in, okay, 300, today is 147th day on the Rock. And so I don't know, I do something like that. I kind of like living on the Rock in Okinawa, great scuba diving. Is a US passport enough of ID at the Social Security office, or do you really need to have an original birth certificate? Is this a trick question? A passport is fine for an ID, but a birth certificate is not necessarily an ID, because I can get your birth certificate. So I can request your birth certificate, but I'm not you. A birth certificate is proof of your age, because the INS doesn't really care about your age. They care about your citizenship and stuff like that. So they're not really particularly historically on your age. They get it wrong quite often, unfortunately. But Social Security, the most important thing is the age. So your birth certificate proves the age. So that's why you probably need a birth certificate, unless you were born in the United States. So the Social Security changed the policy a few years ago to make it a lot easier. So if you were born in the United States and everything looks good on your Social Security card, the date of birth is correct, your name is correct, and your city and state where you're born is correct, and all that kind of stuff. You're like, hey, none of that is on my Social Security card. It's in the system internally. Your card just shows your name and your Social Security number, but under your Social Security number on this Social Security computer, it's called the NUMI, the Numident. um, the number identifier. It has all that information. It has your name, your social security number, your date of birth, your parents' name, your mother's maiden name, where you're born. If all of that is pretty much correct, then you don't even need your birth certificate. Social Security changed the regulation a few years ago. So if it's all correct, all good, then yeah, you don't even need your birth certificate. The Imaginator, hey, what's up? If we get a cost of living raise this year, will I be eligible even though I'm first payment will not start until July? Yeah, so whatever, yeah, it doesn't matter. Everybody in the country gets a COLA increase all at the same time. So I placed a call last week. So how long does it take for someone to get in touch with me? Dun, dun, dun. A call to Social Security or to us, to me. Um, yeah, if it's about Medicare, then yeah, the Medicare team, my Medicare team should call you back. In terms of me, again, I just 99.9% of my help is free and it's through here. I do have a very limited amount of appointments, to pay for the overhead private consultation. So if you're looking for that, just go ahead and schedule an appointment. But in terms of yeah, I get hundreds and hundreds of calls every day and emails and messages, and yeah, I just only 24 hours in a day. So once I become an enlightened dictator, I'll put more hours in the day. But as I always say, the first thing I'm going to do, male pattern baldness solution. So our spousal benefits figured at a percentage of the highest amount, 36% for early retirement. Our spousal benefits figured at the percentage of the highest amount. So the highest amount, so spousal benefits, living spouse benefits are based on that spouse's PIA, the primary insurance amount, that is the amount that person would have received at full retirement age, not delayed retirement credits. A lot of people get that wrong. Not if the person waited till 70. It's not based on that number. It's based on the full retirement age. So yeah, so a reduction for early retirement is based on that. Whatever percentage you're reduced is the percentage is based on the PIA, the amount at the full retirement age. So has he ever met her in real life? Let's scan. Oh, okay. Let's. Uh, oh, somebody became a member. All right. Thank you. Thank you. Thank you. Thank you. R. Stroud 79. Thank you for becoming a member, supporting our work here. Pickleball, Paul. If I set up a Social Security profile on the government website, do I need to apply for Social Security at 62 when I retire? Does Social Security automatically contact me at 62? Thank you for your help. No, the Social Security definitely does not contact you. That's one of the problems with Social Security is, they're completely understaffed. And so, yeah, they let everybody kind of do their own thing. And that's why so many people don't get the benefits they're entitled to because they're kind of just left on their own. That's why, this channel is kind of, pretty much blowing up, is because people are looking for direction. They need help. And once Social Security starts stepping up to the plate, then I can go back into retirement. But until then, unfortunately, no. Yeah. Oh, okay. So yeah, no, you set up an account, and if you want to start your benefits in 62, then you contact them. They are not going to contact you because, you can wait until you're 70 years old and then you contact them, or 62 and a half. And that's one thing I want to point out is there's also people out there that think they can only do anything on their birthday. So like, yeah, I'd really like to go ahead and retire now, but I won't be 63 until next July. And I got to start it on my birthday and stuff in order to get the increase. No, 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 no. You, you can start at any month after you turn 62, or if your survivor benefits 60. So, and every month you wait, your benefit goes up a little bit more. So you can call up and test it. Call up Social Security and says, "Hey, if I retire this month, how much is it going to be?" And they'll say, "Well, $2,000." Okay, if I retire next month, how much is it going to be? $2,012. Okay, what if I do the next month? $2,024. So you don't have to wait an entire year to get the increase. So, uh, pickleball. Thank you so much, Sarge. You are here. Oh, thank you. I appreciate it. I have to cut and paste that, show it to my wife. Thank you for your service, Dr. Weir. You're welcome. Let's see. What if I have a company sponsored medical plan? I started Medicare Part A. What do I need to do? No, you're good. Yeah. If you have health insurance from work and current work, yours or your spouse's current work, and you're happy with it, and your employer has 20 or more employees, you do not have to sign up for Part B. You can do Part A because it's, free. And so that's always a good thing. The premium is free. Um, and yeah, as long as you're not giving to a health savings account. But once you stop working and you stop receiving health insurance from that work, you technically have 8 months to sign up for Part B to avoid that penalty. I wouldn't recommend it 8 months because you know what happens when you don't have health insurance for 8 months. That's when you get sick or fall or whatever. So about a month or two that you're going to be ending your health insurance from work. There's a couple of forms that you have to fill out, and come back here and we'll walk you through it. I've got videos on it as well. Just take one document to your employer, and your employer says, yeah, she's 67 years old right now. She's had health insurance from us since she was 65. Don't penalize her. And that's it. Easy, easy, easy. So you don't need to do anything. Donna, okay, good. All right. People are helping each other out. Mama Deb, hey, I have an HRA this year and an HSA balance from last year. Can I beef up the HSA the rest of this year on my own so I can use it after I leave work and start Medicare? Um, yeah, I mean, yeah, those HSAs are actually pretty awesome. I mean, you get so much tax deferral, and you can eventually use it for more than health insurance. And yeah, I'm gonna have to do a little bit deeper dive on that. Get more into the nitty gritty of those. But yeah, as long as you're not receiving Part A, again, that's more of an IRS. I try to stay away from the IRS type stuff, but so many people have questions on HSA, so I might have to consult with someone and confirm what I think is correct. But I don't want to, I like to stay in my lane in terms of Social Security, Medicare, and all that. But yeah, as long as you're, for Medicare and Social Security purposes, as long as you're not enrolled in Part A, then you can give whatever the limit is to your HSA and HRA and all that kind of stuff. Well, the difference between HSA belongs to the company, and the HRA belongs to you. I think that's one of the major differences of the two, right? I have Blue Cross Blue Shield with my company. I got my Medicare card on May 2024. Awesome. Um, Let's see. I plan on taking my Social Security at 64, not 67. Is this a good time or idea? Yeah, I mean, nobody can tell you. There's too many variables. Life expectancy of your genes, your health, your working. Whether you need the money, whether you can get the money early, and you're a better investor than getting, let's say, 8% per year from Social Security. So yeah, there are just so many variables. And people will charge you $400 or $500 to do a break-even analysis and all that kind of stuff. But I think it's just all a waste of money. So again, the only way 100% you can tell the best time to start your Social Security benefits, guaranteed 100% accurate, is about an hour after you pass away. About an hour after you pass away, I can immediately tell you when you should have taken your benefit. Oh yeah, you should have waited till you're 70. Oh yeah, you should have definitely waited till you're 62. So because we don't know that, you just make your best guess estimate. So, all right, let's see here. Get some TikTok questions. Divorced, was married 26 years. Can I collect on his Social Security? Yeah, if your ex is at least 62 years old and his benefit amount is twice your benefit amount. So your full benefit amount, not what you're necessarily receiving right now, because you still have to file for benefits on your own record. So you file for benefits on your own record. And then if his benefit amount is twice your full benefit amount, then you can collect some on his. I'm a widow. Can I make $22,300 without reporting? Yep, absolutely. Yep. As long as you stand to that, you don't need to tell Social Security anything, because the reporting will happen when you do your taxes. And then next year, when Social Security gets your taxes, they will see that you stayed under the annual earnings limit and they have no issues. So I, well, I'm not hoping. I'm, I think you're talking about 22,000 a year. If you're going to be 22,000 a month, then yeah, you have issues. No, you don't have issues. You're doing very, very well. So hi, you're making 22,000. How long do you pay the capital gain from the sale? Condos to, yeah, well, the capital gain, that's an IRS, but in terms of the extra Medicare premium, the Part B premium, it's for 12 months. Yeah. So only for 12 months, you'll have to pay that extra premium. And I mentioned it on this video too. If you make, if you made X amount from the sale of your home, and you worked that year, together that puts you over. But since you have stopped working, then do that SSA 44 because it's a life-changing event. Sure, you sold your home, but the other part it was income that you since worked. So you do a life-changing event form and says Social Security says, hey, a lot of that income was actual income that I was working, but I have since stopped working. And they might just say, oh, okay, all right, if that's the case, then no extra premium. My husband stopped Social Security to go back to work. How does he start back up? They're holding money. Yeah, so you just do a work report. You call Social Security and say, okay, with you're withholding my husband. Well, he has to call. You're withholding my money because I was making X amount of money, but starting this month or this next year, whatever the case may be, I am going to earn less. And again, you can't do the monthly earnings thing again. You can't say, okay, next month I'm going to be under 1860. That's, you have to be under for the whole year. So, does my work coverage convert to my supplemental plan once I file? Okay. So we're talking insurance here. No, a supplement is no, it doesn't convert. The Medicare supplement, either a plan G or a plan N. So when your health insurance from work stop, you sign up for Part A and Part B, unless you've already signed up for Part A, but you sign up for Part A, Part B, and then if you want to get a supplement, which I recommend, almost everybody does, Plan G or a Plan N, then you have to pick a company and find one. I did a video on Medicare supplements, the best one. The lowest price is not necessarily the best one because once, it's with Medicare supplements. Medicare supplements are the only health insurance in the country that can discriminate against you because of pre-existing conditions or your health issues. Like Obamacare, it doesn't matter how sick you are, the Affordable Care Act, Marketplace, whatever you want to call it, doesn't matter how sick you are, the company has to give you health insurance. Medicare Part A, Part B, doesn't matter how sick you are, they have to give it to you. Medicare Advantage, doesn't matter how sick you are, they have to get it to you. But Medicare supplements, once you get into once you're 65, they can't, discriminate against you. They can't hold that against you. Even when you're 70, but you just got your Medicare Part B card, you're in that golden window where they can't discriminate against you. They can't deny you. But a lot of there are exceptions, but a lot of the other times they can. So what a lot of people do is, hey, I found this company, the Eastern West New Jersey firefighters Medicare supplement plan. It was only, $12 a day, a month. And, yeah, they got you in for that low price. And, then a year, 2 years later, you get sick and that company's, raised prices, 400 times, or they're no longer a business or whatever the case may be. So I recommend the big 3 or 4 or 5 companies. They've got the most people and most sustainability because unlike Medicare Advantage, you have to change those. You have to review those every year. And this year is the most important year to review your plans. If there's a better plan, change, but if not, just stay with the same plan. It'll automatically renew if you don't do anything. It'll renew with probably a different than what you think it is if you don't review it and become aware. But Yeah, Medicare supplements once you sign up, you're good for the rest of your life. But watch out for the price increases. All right, let's see. Do I need to bring my original Social Security card to the Social Security office? Nope, nope, nope. Don't need your Social Security card at all. Um, Julie, if claiming a spouse widow benefit, does it pay 100% regardless of age? I'm 62 and had just started my own early. No, not 100%. You won't get 100% of your deceased spouse's benefit amount unless you are your full retirement age. So, and surviving spouse benefits are very weird calculations. You get delayed retirement credits with that, but it's not necessarily based on the PIA unless that person hasn't filed. Yeah, so the whole thing is um, oh, yeah, you called your team. Oh, okay. Yeah, then, yeah, do me a favor. Or if you're looking for, yeah, Medicare help, sorry, not sure why they didn't respond. Um, so, yeah, send me an email. Send me an email with your name, phone number, state, and then say, hey, I'm looking for Medicare, yada, yada. And then I'll make sure they give you a call. Scott, should you go into the Social Security office on the day of your birthday to maximize timing and maximum payout? No. Or does it matter if you are a day or two behind? Nope, nope, nope. You can go month or 2 months. If you want your benefits to start on your birthday month, yeah, just, about a month, 2 months, 3 months before that, then call up, schedule an appointment, phone appointment, go online, whatever the case may be. Yep. Doesn't, and you can, if you if you schedule an appointment, your appointment is a month or 2 months before that, and you say, hey, um, I want it to start on my birthday, and they tell you the number, and it says, hey, what if I go ahead and start it now, 2 months early? And they'll tell you the number, say, oh, it's reduced $14, but then I get, $4,000 extra in my pocket. So forget about the $14. So I'll take the $4,000 now. So kick around your options. Let's see here. When I retire, I have to pay for my health insurance through my employer. Can I have it auto deducted from Social Security check? No. Yeah, no, not for private insurance like that. Does Social Security change over to SSI at full retirement age, a Social Security disability? SSD is more than SSI unless they get living spousal benefits. So SSI, yeah, you're probably just thinking about Social Security, but SSI is a completely different program. That's the welfare-based program. So you don't mean SSI. You mean just regular Social Security retirement benefits. So yes, Social Security disability benefits switch to regular retirement once you hit your full retirement age. And nobody realizes it happens because you know it's just basically you get the same amount as you did the month before, and it's on the same payday and everything, but now you don't have to deal with all the CDRs and work limitations and all that other kind of stuff. So thank you. You're welcome. How do you beat a CDR while having a non-curable disability, which you're on several medications? How do you beat a CDR? Yeah, watch my videos on CDRs, and um, my strategy I've come up with is FCF. Forget about CDRs. When you get it in the mail and actually get it, complete it, and then forget about it again. So please, Social Security stresses too many people out about continuing disability reviews when you're on disability. And a lot of it is driven not by you, but it's by the federal budget. So don't let the federal budget freak you out and stress you out. I'm sure you've got more than enough stressors in your life than to worry about the bureaucracy. So just when you get it, fill it out. Watch my videos on CDRs. Just fill it out, send it back, make copies, send it in, and please forget about it. Because as you'll see in my video, Social Security just might forget about it because it's a budget issue. So, is the USA the only place where we literally make bets on our death day? Yeah. Um, I'm personally going for 2120. So that's why I always lose in Vegas. I turned 66 and a half for on April and will file for Social Security and still work. Does it matter how much I earn? No, it does not. If you're your full retirement age, you can make $1 billion a month and enjoy your yacht in Monaco watching the Grand Prix. Um, X died at 59 10 years ago. I want to draw now while I get the percentage of his full benefit. All right. So, yeah. So if he passed at 59, he never collected his benefits. So you can get 100% of his benefit amount when you turn your full retirement age. So if you file early at 60, then it's going to be reduced. At 61, it's reduced. At 62, it's reduced. So every month you file early, it'll be reduced. But you can get his full benefit amount um, at your full retirement age. How often does SSDI recipient get reviewed by Social Security? I've been receiving for 5 years and wondering. Yeah, so basically what it is, it's your MIE, medical improvement expected, and when your claim is adjudicated by a DDS examiner or the judge or whatever, they put down, okay, this person needs to be reviewed every 3 years or 5 years or 7 years or whatever the case may be, and that's how they go. So it sounds like you are on a 5 year rotation. So all right, but again, it's watch my videos on CDRs. It's completely budget driven. So 5 years from now, you might not get one because Social Security doesn't have the budget to do a CDR. I'm on Social Security disability 63. I'm widowed, but my husband died at 28. Will I be on Social Security till I die? Um, yeah, yes. Disability will continue. Again, it will continue until you hit your full retirement age. And then once you hit your full retirement, it'll just be switched over to regular retirement. Again, same check, same pay date, and all that kind of good stuff. You won't even notice the change. But yeah, then you'll get retirement benefits for the rest of your life. Is it better to take SS benefits now? I'm almost 65, or wait until my full retirement age. Again, completely your decision based on your life, your family genes and whether you need the money and a whole bunch of variables. I've got a bunch of videos on, a bunch of ways to decide when to take your benefits. Again, there's no 100% perfect answer. Nobody has. I get widow's benefits. What is the percentage I am getting? It just sort of seems like a small amount. Just saying. Yeah. So it basically, if you file for benefits on your own record, and then you also file for survivor benefits, then what they do is they give you your benefits, and then the difference between the two they add on for the survivor benefits. So yeah, if it's not very much, make sure you watch my videos. I've got 4 videos on living on Social Security alone. There's like 47 different programs and ideas in there to hopefully make your life a little bit easier. And as always, I have to apologize for the super long introduction video 1. So just ignore that and skip through it. And it used to have 48, but one of the programs, the FCC's $30 help to give internet, that program went away. The program went away about a week after I made that video. So what are you going to do? 2 people are receiving survivor benefits. If one no longer eligible, does the other person's benefit increase? No, it does not. One benefit amount doesn't affect the other benefit amount. So even with a living spousal benefit. So if you have 3 divorced spouses, they could all be receiving the exact same amount of benefits from that one X. And one doesn't affect the other at all. Could you imagine that? If it did? It's like, well, if I hate that other ex and the first wife or something like that, and so if she disappeared, then my check would increase. Yeah, that would not be good. I'll be 63 this year. When is the best age to retire? All right. Do you have to pay for Medicare if you get SSI disability? Okay, so SSI disability, so that's the welfare-based program. So you're probably meaning SSDI disability. Yes, everybody has to pay for Medicare, unless you get the state to pay for Medicare Part B premium for you. I did a video on this. It's called the Medicare Savings Program. So if you're having difficulty paying for your Part B premium, then contact your state social services welfare office, what do they call it in your state, and say, hey, I got Medicare, but $174.70 is tough. Can y'all hook me up and pay for my Part B premium? And they'll ask you a bunch of questions and take an application. And if they approve you, you'll get Medicaid and Medicare, and Medicaid will pay for your Part B premium. And you'll probably have a lot of other advantages too. You can also get a Medicare Advantage dual eligible because you've got Medicare and Medicaid, and then you'll get so many other extra benefits depending on your particular area. So if you want help evaluating what's in your area, give me a call, leave a message, your name, phone number, your state, and what you need help with, and I'll have my Medicare broker team reach out to you and give you all your options for free and no obligation. All right, LC, can I still work and collect Medicaid and then roll into Medicare and Medicaid at 64? Yeah, Medicaid, so that's the welfare-based program from the state. So if you make too much, they could very well kick you off of Medicaid. So I would reach out to them and make sure you keep them aware of any work you are going to do. Medicare, it doesn't matter. Work doesn't matter. So unless you're making over $103,000, and then you'll have a extra Part B premium. So I am mandated a vaccine-injured nurse, and my health day-to-day is unpredictable. So I filed for Social Security retirement in January. My full retirement age is December 1st. I am still working. How do I pay my tax? Yeah, I don't do taxes. So I just contact the IRS. 160 of us hit the like button. Yeah, it's all right. Yeah, everybody press the like button. I wish I could see who pressed, or how many people press the like button, but y'all always look out for me. So Mickey Collins, I think Mickey is the new here. I don't think asked a question before. I've been on SSDI for 13 years, but now the SSDI adjudication worker is sending me paperwork like what I do from my get up to go to bed. What does this mean? Okay, yeah, so it sounds like it's just a regular review. Don't sweat it. It's just part of the bureaucracy. Congress mandates Social Security, to do this every now and then, and they give Social Security an extra budget to, make sure that, people are actually still disabled or, whatever. So just fill it out. Watch my videos on CDRs, and yeah, don't sweat it. Just fill it out to the best of your knowledge. Those forms, government forms, are government forms. They're complicated, and you say most of this stuff doesn't apply to me. Well, that same form goes out to tens of millions of people, so it applies to 1 million people, but not the other 9 million people. This particular question, the other question. So yeah, just if it doesn't apply to you, just put NA. Make a copy, and then send the original back to Social Security, or take it down there, whatever the case may be. Fax it in there. Yeah, so yeah, there are faxes. So yeah, but don't worry about it. Just complete it and forget about it. Cynthia, hit the like button. Thank you. How does covered California insurance differ from medical and Advantage plan? Okay, yeah, so covered California, so that is the Obamacare marketplace. So yeah, if you contact me about the marketplace Affordable Care Act Obama one, I'm in the midst of putting a team together. So I wonder if I've gotten a few emails and contacts from people looking for that type of insurance, and I'm not there yet. I'm putting together a team, hopefully, that can get all states in terms of covered. Wow. Medicare also kind of regulates that as well. And there's been just terrible things going on with the Affordable Care Act and marketplace insurance, is that agents have been going in there, and you push a button on Facebook that, you want this or free that, and the super, super small print that gives that person, that agent somewhere in the country, hopefully in the country, authorization to go into your covered California or Obamacare marketplace and change stuff. And what they've been doing is they will change your income $1, and therefore it's a change. So that agent now gets commission. And but Medicare finally, the CMS, Center for Medicare and Medicaid Services, finally shut those people down. Oh my gosh, it's been the Wild West in the worst sense for the last year or so because of these idiots doing stuff like that. So that's why I decided, come on, y'all got to do the right thing. So that's why I put together a Medicare team, and now I'm working on, Obamacare. Um, they're trying to find anything you can do physically to make an excuses you can work a job. Yeah. Again, it's just it's nothing personal. It's just Congress says, hey, you have to do this many, you know, and you have to, was it Eminem? There are people out there that are receiving Social Security disability benefits that are, working and actually should, are able to work. There is fraud out there. So, and that's what those are intent. So, but if you're not committing fraud and if you're truly disabled and not able to work because of your disability, then don't sweat it. I've got one guy, I've mentioned this story. He was in a car accident, lost both his legs, and he responds back to that letter and says, "Yep, my legs haven't grown back in the last year. Thank you very much for playing." So, um, but again, he could. I mean, FDR couldn't walk, so it really depends on particular situation. He had other issues too, but other than an awesome sense of humor. So, being an old Marine, I'm used to that dark sense of humor. I have to work. I will look forward to watching later. Thanks for all you do. It is greatly appreciated. Yes, yeah, that's why I think I've come up with a good format, doing the topic of the day and then question and answers. So I did 400 other attempts and they were all failures. So I think we finally trial and error. I have Medi-Cal. I turned 65 in September. What do I need to do to get the dual coverage? Okay, yeah, so perfect. Yeah, if you have Medi-Cal and you're turning 65 in September, if you are going to receive Medicare, so you have to have for the dual means you have Medicare and Medicaid. So as soon as you get your Medicare number, your Medicare card, give us a call, or again, a broker and Medicare insurance broker that you know and trust. If you don't have one, give us a call, email me, and I can have someone go over all your options, and then you decide what you want to do. Lisa, my birthday is September and told me wouldn't get anything until November. Yep, that's right. So yeah, unless your birthday was on the 1st, and then they consider your birthday to be the prior month. But yeah, so if your birthday is in September, you're 62, or even it doesn't matter if you're 62. If your birthday is in September, you won't get your first check until November. Everybody gets their check a month late because eventually that check has to stop at the end. So you have to be alive the entire month for you to get that month's check. That's why they pay it a month back. Medicare, you pay a month early. So, does your initial sign on B date last 1 year or 6 months for trial right purposes? So, so for 6 months for trial right. So for trial rights, so you can try a Medicare Advantage plan. So as soon as you sign up for a Medicare Advantage plan, then you have like a 1 year trial right. And if you don't like your Medicare Advantage within that first year, then you can switch to a Medicare supplement. If you're getting close to that and you're worried about the timing, again, each state is very, very wonky. Reach out to your Medicare broker or give us a call, and we can check the system and see exactly when you have to make your decision by. How much can a person earn if they are fraud and collecting Social Security? $1 billion a month. So it doesn't matter anymore. Julie, I just signed up for May 1st to Plan G supplement. Can I change to plan without penalty underwriting? Oh, like a Plan N? Possibly. Wait a second. You just May 1st. Yeah. Yes, you can. I just got an email today, or not an email. Somebody left a message in the YouTube. I've got so many YouTube messages to get back to, so I apologize if you left a message. I've got hundreds to get back to. But yeah, somebody just, I noticed one that stood out today. Some sneaky agent broker out there somewhere said, "Oh no, no, Plan N for Nancy is going away, so you can't get that one anymore because the agents get more, a little bit more when they enroll you in a Plan G, and a Plan G is so much more easy to explain and stuff. So lazy people that want more money, push Plan G. Plan N saves you money, and I think it'll save you a lot more money in the future. But it's a little bit more difficult to explain as well. If you want but G is perfect. G is awesome. But I recommend N because I'm a cheapskate and I like my money. Well, I like spending on other junk I probably don't need, so I guess I don't like it. But if someone hasn't worked for 30 years, will their disability income change to Social Security? Yeah, everybody switches to regular Social Security. So, all right. So we've got we're at our hour. So I'm going to do. Let me see. I'm going to see if I can find some new people here. Wendy, I don't think Wendy's ever asked a question regarding spousal benefits. Is husband if husband is 72 and passes away, and I'm receiving SSDI at 57, does Social Security provide husband's current benefit amount or when started his benefit? Okay, so it really depends. Yeah, that's why spousal benefits are there's so many variables. If your husband waited till their full retirement age, so you have to wait till your full retirement age is to get the 100%. Then you will also get the delayed retirement credits he was added. But essentially, if you're your full retirement age and you start your spousal benefits, then you'll basically get whatever he was receiving. That's probably the best rule of thumb. So, but you're on SSDI and receiving at 57. So yeah, so you have to, the soonest you can get those benefits is 60 years old. And because you're going to be receiving it, several years early, it'll be reduced. But then again, you're going to get benefits starting 60. So I would definitely check it out and call Social Security and say, hey, how much are, the survivor benefits when I turn 60 years old? And they'll give you the numbers. And then you just say, okay, what if I wait a year? 61, how much is it going to be? And they'll give you the numbers. And then you can make your decision, an informed decision. That's what it's all about, an informed decision. Okay, we got the follow-up question here. Donna, Vax Engineer. I meant, how do I pay Social Security tax while working? $1 every two. Oh, okay. Okay. All right. So yes. Okay. In that case, I can answer that one. So yeah, not really a tax. It's money out of your pockets, I guess. In some respects it's a tax, but it's not. It's a withholding. So yeah, if you're going to be $2,000 over, Social Security doesn't know until you do your taxes next year, and then they'll just send you a cute little letter that says, hey, you went $2,000 over, you owe us $1,000, and you just write them a check or make other arrangements. If you know you're going to go a lot more over this year, 10, 20, 30, $40,000 over, you just call Social Security and say, hey, I'm going to go over this year by $10,000. And then they will put that into the system. And if everything goes right, they will withhold X amount of checks. So they'll say, okay, you're not entitled to the next 5 checks. So they'll withhold those checks. So that's how that happens. All right, that'll do it for today. Y'all have an awesome night and Memorial Day, and y'all take care, and we'll see you